welcome to the RCAHD biweekly situation update. I will be recording this and getting the recording out to you after, along with the data set. So with that, Dr. Morrow, are you ready to take it over?
I am, thanks.
I'll start.
Okay, so as usual, I'll start with the situation update and on disease activity and then move to our vaccine update. So unfortunately, as we're seeing across the country, across the globe, we continue to see an increase in our COVID-19 infection numbers in the Roanoke City Alleghany Health Districts. So if we look at last week, we are up 888 cases in the last week alone. This is disappointing, but not unpredictable based on the trends over the last couple of weeks. So at this moment, we've had a total of 38,019 infections reported in residents of the Roanoke City Alleghany Health Districts. We continue to see people under the age of 35 disproportionately impacted, with about 50% of our cases in that age group. Unfortunately, our hospitalization numbers are paralleling that with our hospitalizations back up in the 70s. So this past week, we have 74 people in the hospital. Of those, 50 are new hospitalizations. 23 are from the Roanoke City Health Districts and 51 are from the Alleghany Health Districts, of that total of 74. In addition, we continue to see beloved members of our community die from this just terrible virus. So we are currently at 680 people who have lost their lives to COVID-19 in the Roanoke City Alleghany Health Districts. So unfortunately, with respect to COVID-19, we continue to have significant levels of disease activity within our community. It's important to note that for us across the board, our rates of infection, our rates of hospitalization, and our deaths are overwhelmingly in individuals who are not yet vaccinated. So speaking of vaccines, the good news is that we are continuing to see people get vaccinated, even first doses. And I know I've said this before, and I'll say it again, we're going to continue to do everything that we can to help people understand the benefits of vaccine and to provide vaccine to them in whatever way is easiest for them to get vaccinated. In our community, our pharmacies continue to offer vaccines. We have the CVC, and certainly we have a lot of our healthcare providers who are partnering with us to make sure that people have access to vaccine in the place that is most comfortable for them. So if we look at our community, just in the last week, we've had over 15,000 doses administered, and most of those are booster doses, but we have had several hundred first doses as well. So there's room for optimism to know that people are taking this seriously and are taking measures to combat this ongoing pandemic. And as we've said every week for the past many months, we do have the ability to control this through layered mitigation strategies. Vaccine is the best tool, but in the meantime, we need to continue to be vigilant with respect to social distancing, wearing masks, and washing our hands. And so with that, I'll open it up to any questions. Not hearing any questions.
Hi, Dr. Morrow. It's Leanna Scacchetti with WDBJ7. Can you hear me?
I can. Thanks, Leanna.
Hi, I just was wondering if you could recap, and I'm sorry if you addressed this at the beginning as I was jumping on and getting our live stream started, but anticipation coming out of the Thanksgiving holiday. I know sometimes it takes a little while for the data to come through, but could you just reiterate or say, share with us kind of what your understanding is, case counts coming out of Thanksgiving in anticipation for the holidays to come?
Yes, so we've seen a pretty significant increase. We had dropped down to about 400 new cases per week. And we have gone back up, obviously, in the wrong direction. So this week, we're reporting almost 900 new cases just in the last week alone. The more disease there is out there, the more disease is spreading. And so we certainly expect that this trajectory is going to continue, in part because of the holiday season and people gathering over Thanksgiving, and unknowingly transmitting it over those gatherings. So we do expect this trajectory to continue. And I think that the only thing I can stress is that we know layered mitigation strategies work, and we need to continue enacting all of those mitigation strategies to reverse this trend. I see a question from Jean. Have we seen any Omicron variant here yet? No, I'm not aware of any reports, certainly not in our area. But we have every reason to believe that Omicron will get to our community. And what we do know about it so far is it appears to be more transmissible. And so it's unfortunately, we know that when there are high levels of disease activity, we will face the ongoing threat of the emergence of new variants. And it is yet one more stark reminder of how malleable this nasty virus is, and how, as long as there are high levels of disease activity anywhere in the world, we are all vulnerable.
Dr. Morrow, how much are people taking advantage of the opportunities available for treatment for the monoclonal antibody treatments? Are those still being used, as heavily as they were during the Delta surge?
Well, I really don't have numbers on utilization. We do talk about access and making sure that our health systems have access to any option that is available to mitigate or to really decrease the impact of this virus. So I don't have any data on utilization. I'm so sorry. I can try to find out, but I have not heard of any concerns about access, and that would be where we would really work with our community health partners and with the central office to address any concerns. I know that in the past, healthcare systems have reached out to me to support them in getting more access. That has not been the case. So indirectly, I believe that access is not an issue in our community, that if people are eligible for monoclonal antibody, there are places where they can get it. And the most important thing with that is to talk with their healthcare provider. And work with their healthcare provider to have access to that intervention.
We do have a question from somebody in our comments who wanted to know, if you are vaccinated, are you protected from Omicron, or will you need to get the booster for protection specifically for this variant? Can you just, I guess, explain a little bit more about what is available in our vaccines right now, and what kind of protection we might have from this specific variant?
Sure. So what we know to date, and I think it's really important for us to be transparent, that this is a new variant, and so there's still a lot more information that we need to learn. But to date, what we understand is that there is good coverage of the current vaccines against Omicron. So at this point, we have no reason to believe that they don't work. We have every reason to believe that the vaccines are effective. Now, with respect to being fully vaccinated versus having your booster, we strongly recommend that anyone who is eligible for their booster, so if you're 6 months after Moderna or Pfizer, one of the mRNA vaccines, you are eligible for your booster and you're above the age of 18. 2 months after Johnson & Johnson, if you have not yet had your booster, I strongly encourage you to go get your booster. We need to have as optimal immune responses as we can as we go into this next surge associated with what we expect. The next surge associated with Delta. Delta is still overwhelmingly the predominant strain here. And as we anticipate that Omicron is going to cross our borders, we have into the Roanoke City Alleghany Health Districts, we have no reason to believe that it won't. So I think we have to anticipate that it's going to get here at some point. But right now, The overwhelming strain is Delta. We know the vaccines work. And to the best of our knowledge, knowing that this is a new variant, it appears that the vaccines also are effective against Omicron. So it's such a challenging message, because what we also know is that when there are high levels of disease activity, even people who are fully protected can get COVID, because no vaccine is 100% effective. This is a safe, effective vaccine, particularly with respect to decreasing hospitalizations and deaths. But as long as there's this much activity, we will see breakthrough. And again, our best tools against this are for as many people as possible to get vaccinated, and for us to continue that layered mitigation strategy, so that we're all protecting ourselves. So I know that was a long answer. Bottom line, we believe that the current vaccines are effective against Omicron. The evidence so far supports that. Delta is still the overwhelming predominant strain, and the vaccines are effective against that. If you are not yet boosted and you are eligible to get your booster, please go get your booster. We know that additional immunity is necessary under our current situation. I see a comment from Gene saying that he went to get his booster at Valley View and it was easy in, easy out. So I think, the numbers speak volumes. So we have vaccinated over 15,000 people at the CVC at Valley View Mall, including over 2,500 children aged 5 to 11. So, all reports that we're getting are that this is Gene's experience, easy in, easy out, super convenient, super efficient. We're really fortunate that we have this community partner available to us to provide vaccines to all of our residents, not only in the Roanoke City Alleghany Health Districts, but across the region. We want anybody who has any interest in getting vaccine to know that this is a regional resource. So we think that it's made it easier. The numbers, I think, show that story. And we're very fortunate that we continue to have this resource available to us. In addition, the CVC is actually helping us with some of our schools. And for those schools that are interested, the CVC is helping us vaccinate some of our children at an area that's convenient to them, and that's at their school district. How often will people have to get booster doses moving forward? Right now, the only booster that we only have one booster. We don't know what the future holds. I think that most of us, if not all of us in public health, believe that this will become endemic just as influenza is. The periodicity of how often we need to get boosters remains to be determined. Hopefully once a year with our flu shots will be sufficient, but this pandemic, COVID-19, continues to surprise us. And we just need to be really flexible and open to allowing our knowledge, as our knowledge changes, as the information that we gain changes, and then we learn from that information and gain knowledge. Our guidance has to follow the evidence, and that evidence continues to emerge. So I'm hopeful that we'll get to a place where we have endemic disease that is responsive to a once a year booster with our flu shot. This is all speculative. We do not know this. I cannot reiterate that enough. But time is what will tell, and we just don't know yet. Is there a particular age group being hit harder in the latest cases? Are we seeing outbreaks in nursing homes? That's a great question, Tom. With respect to age groups this week, so we've been seeing between 20 and 25% of all of our cases in children under the age of 18, of course, as the definition of children. This past week, it was actually about 15%. But we continue every week for months now. We've seen between 40 and 50% of our cases in the under 35 population. And so this week specifically, it was 47% of our new cases were in individuals under the age of 35. So this continues to disproportionately impact, in terms of the infections, people who are under the age of 35. And we believe that a large part of that is that there are lower vaccination rates in that age group. With respect to hospitalizations, we continue to see older populations disproportionately hospitalized, and that, we know that age is the great predictor of poor health outcome associated with COVID. So we're seeing people in their 50s and 60s as the primary age group that's being hospitalized. Thankfully, the age group that is most vulnerable to COVID, which is our older than 65 population, we have extremely high rates of vaccination. And subsequently, we're not seeing the huge numbers of individuals in that age group in the hospital. And again, that's the disease activity mirrors the vaccination rates, which I think is pretty strong evidence of how effective the vaccines are. And then Jean asked, do you see Valley View Center being open after the holidays? To my knowledge, we are going to have this resource available to us as long as we need it. Now, we initially thought that we would only need it through the holidays when we were projecting that we would continue to see that downward decrease that we saw where we had peaked in mid-September, and then we started to see that decrease. Given this new trajectory, we're looking into the spring. I hate to be the bearer of that news, but I think that given this trajectory, we're going to see an ongoing need for the indefinite future. And I'm just really thankful that right now we have this resource available, and we will continue to advocate strongly that the resource continue to be available for as long as we need it. And my understanding is that as long as there is a need, it will be there for us. What do you want people to consider as they look at the risk of gathering together for the holidays? It's such a great question that none of us have the answer to. We are all so tired of this virus. We are all so tired of having to wear our masks and having to minimize our gathering. Yet, given where we are right now, we need to have these multi-layered approaches. We need to continue to physically distance. We need to continue to wear our masks indoors. We need to continue to encourage everyone around us to get vaccinated, and to try to understand, to use compassion and not be judgmental about people who are not yet vaccinated, but to really try to understand and work with them to figure out what their concerns are and how we can address their concerns. In the meantime, we need to be careful. If we have families that are completely vaccinated and everyone in that family is vaccinated, it is safe to have small family gatherings and even moderate-sized family gatherings. But if there are individuals who are not yet vaccinated, it's just not safe. So we need to continue to do everything in our power to decrease transmission among our loved ones, and that means assessing the situation with your family members and making the best decisions that you can for the unique situation of that family or that social gathering. And I see that Christy has added some resources from VDH that can talk about the social gatherings. So I appreciate that. Thank you.
Hey, Dr. Morrow, I've got two more questions for you. One coming from Nancy, and she's one of those folks who has had a breakthrough case of COVID, and she is recovering, but she wants to know how long should she wait as she recovers from this case to go get her booster? Do you know what the current recommendation would be?
Well, first, Nancy, I'm so sorry. You've done everything that you could to protect yourself, and it's so frustrating when someone has breakthrough disease, because we know that they did what they needed to do. So I'm so sorry that you experienced that, and I'm thankful that you're recovering. With respect to timing after a booster, after infection, there really isn't a set time after infection where it's optimal to get your booster. What we do know is, first of all, of course, anyone needs to be at least 10 days out, because for those 10 days after initial infection, isolation is required to prevent the spread of disease to anyone else. So certainly a minimum time frame would be 10 days. I would say, you do have some protection now that you've had the infection, unfortunately, on top of being previously vaccinated. So you are protected. And I would listen to your body and give your body time to recover. And when you're feeling better, go ahead and get your booster. The big question I would probably say, or the big issue or not issue, my big point would be, if you have any questions or concerns, would be to talk to your primary care provider and make that decision with your primary care provider. But from a strict perspective, anytime after your isolation period, 10 days, you are eligible. And I probably personally would wait until I'm feeling better. We don't want to confuse a sore arm or body aches after getting vaccinated with any concern of sequelae of an infection, if that makes sense.
Thanks, Dr. Morrow. This is my last question, as I know I'm sort of dominating the space here.
I appreciate it.
But just wanted to know if you had any update regarding the hepatitis A local infections. Obviously, we saw a woman recently released from the hospital after her infection, but I just wanted to know if you had any updates on that front.
Thanks, Leanna. We don't have any updates with respect to the outbreak that we had, but we have had more cases that are not related to the outbreak. And we're seeing that across the country and certainly across our region. And I think that this there are individuals who are at increased risk for hepatitis A. People who have been incarcerated, people who use IV drugs. There is just an ongoing baseline endemic level of hepatitis A. And unfortunately, we do continue to see what we would call sporadic cases of hepatitis A in individuals in those in that higher risk group. And so we really want people to understand that hepatitis A is a vaccine preventable disease. Hepatitis A vaccines are available. It's a 2-shot series, and we certainly encourage anyone who is in one of those high risk groups to get vaccinated, and anyone who wants to be protected to go ahead and get vaccinated. Tom asked about whether we've seen outbreaks of pertussis. We have not experienced any outbreak of, we do not currently have any outbreak of pertussis in our region. Pertussis is another insidious vaccine preventable disease that can, once it's in the community, can spread. But thankfully, we're not seeing that in our community at this time. Okay, I'm not seeing any other questions in the chat. I'll pause for a moment to see if there are any other questions.
All right. Well, thank you everyone very much. I'll get this optimized to get the recording back out to you along with the data set, and you can ask me any follow-up questions as needed. Thank you all for your time. Have a good day.